Hi everybody, this is Hospice Joe, where my goal is to help anyone and everyone with any symptom management in the last 6 months of life. So today our symptom is pain. The definition of pain is physical suffering or discomfort caused by illness or injury or an unpleasant sensory or emotional experience associated with actual or potential tissue damage. Pain is subjective, meaning it feels different from one person to another. It's kind of like, you got the big burly dude with tattoos going in to get his labs drawn, and he cries when he's poked. Meanwhile, the little 87-year-old that comes in with the same thing doesn't hurt at all. So it is subjective. We don't know what they're feeling. It's a complex signal processed by the nervous system, which the perception of pain can be altered if there's an alteration in the nervous system, like diabetes. For example, diabetics usually, they can't feel their feet, and they could have a sore and not even know it until it smells. And then they look down and oof, there's a sore. So that can impact it if you can't feel it. There are different types of pain. There's nociceptive, caused by tissue damage or inflammation, like an infection, broken bone, or cut. There's neuropathic, like I was talking about diabetes. It causes damage to the nerves, such as shingles, or like the diabetic neuropathy. It causes like burning, tingling, electric shocks. Nociplastic, not linked to clear injury or disease, but caused by change in how the neuron systems process like pain signals, like fibromyalgia, chronic lower back pain. There's acute and chronic pain. Acute is like you cut your finger and it heals within 30 days. That's like an acute pain. Chronic is like it lasts longer than 3 months. Not always tied to the initial injury, but can be. Kind of like if you sprain your ankle in softball in high school and then later on gets cold and you start feeling that ache in that same spot. That's more chronic. How do we know if a hospice patient is having pain? Well, we have a couple different ways of assessing that. One is just the normal 0 to 10 scale that we use in the hospital. 0 being the no pain, 10 being the worst pain you ever had. We also have the Wong Baker face scale. Basically, it's like if you grimace, furrowed brow, you're trying to guard the area that hurts. That's some indicators. Heart rate elevation. Those kind of things will tell us if somebody with dementia or somebody comatose has pain, moaning, yelling out, that kind of thing as well. How do we manage pain? Well, you can do a lot of things without meds, which we got things in hospice like therapeutic massage. They're trained masseuses that come into the home, into the facilities, wherever needed, and give light touch massage. They are trained to know how to deal with different disease process and, light, hard touch, that kind of thing. We also have music therapists that come in and they give, a soothing song or whatever. Hopefully they have a pretty good voice, because you wouldn't want like a chicken squawking at your bedside. But they have to have some sense of a good voice to do that. As well as spiritual care. Spiritual care is very important for pain. Because pain's kind of like a holistic approach. You got physical, emotional, and spiritual. And I think all those are important to address when we're looking at pain. Of course, we have medications. We have liquids, pills, short, long-acting. We have skin patches like fentanyl or Duragesic, where it comes out of the skin over time and gets into the system. It's changed every 72 hours. And then there's like injections and pain pumps. We typically don't use those in hospice settings. The most common for hospice is morphine. Morphine's the big guy, and I am going to do a whole video on morphine, because I feel that everybody needs education on that, because people look at hospice and I think they think of morphine like we're killing people with morphine. So I definitely want to get more in depth with that medication, just in a whole video. We also have oxycodone, hydromorphone, Duragesic patch, like I said. So the golden nugget of the day is pain is subjective. That's a big one. You have acute and chronic pain. There's many ways of treating pain with medication ways as well as medication. And so I just hope that you have a really blessed day, and I hope you learned something with this video. Please comment if you like and subscribe, and you have a great day. Thank you.